What's up, you guys? Hey, thanks for watching this video. In this video, I want to talk about, actually, I'm going to answer a question I just got this morning on email. Somebody asked me, what if I don't like gross stuff and I still wanted to go into medicine? And that's an interesting question because there's a lot of gross stuff in medicine. I don't know if I told you guys a story about how when I was an intern and I was like having a little bit too much fun the night before, and then I went to work in the morning. This guy got a gunshot wound to his abdomen, and I was basically a retractor. That's what you are when you're an intern, is you're a retractor for the surgeons that are operating. And opened the guy up, and it was like blood and ground up. Like, the rule is before you get shot, you have to go to McDonald's and eat a lot of stuff. So there was like French fries, half-eaten, hamburger, half-eaten, milkshake, and then the bullets went through his colon, so there was shit in there, and then there was, of course, a lot of blood. So it was like half vomit, half sort of ground up food, and then poop and blood. And when you're hungover, that is not a great combination. So I did not barf in my mask, but I was pretty close. So stuff like that happens sometimes, more in surgery, I think, than anything else. But there are some really bad smells in medicine, that's for sure. I won't go into any more. They're pretty bad. It's an interesting question, and I don't think anyone should feel like I can't do this because I don't like the sight of blood. Well, maybe that might be a problem. But even if you want to go into internal medicine, there's a little bit of that, but I don't think there's a ton. And I will tell you that the point I wanted to make is that I know a personal friend of mine who was a medical student, wanted to go into surgery. She passed out on her first surgery. Just like, good night, dunk, fell right over. So she felt really bad about that, but that's actually kind of common thing to happen. I mean, not everybody, but, a good percentage of people, 10, 15%. Maybe at least get lightheaded and stuff like that. So it's not something you can't get over. There is a surgeon that I worked with for a while who had been working for a long time, like 15 years. At one point, he had an operation where something went wrong, and he passed out. There was other surgeons there. So it's not prohibitive of going into medicine if you are a little bit queasy, but at some point you're going to have to get over it a little bit. So I suggest maybe going out and killing some cats and opening them up and you guys. You do have to ease yourself into it. But this is like a cognitive behavioral therapy type of situation. Like, you can actually go and sit and watch gross movies. You can pull up pictures on the internet that look bad. Like, you can ease yourself into it and eventually get to the point where you can see that. When I was first operating, it was very strange, like cutting somebody's belly open. I didn't get sick, but it was like a little weird to me. And what helped is that when we drape the patient off, and so you end up with only a square of their abdomen showing, that for me disconnected the patient to the operation. And that helped for a while until I got so comfortable with it that you do enough of them that you don't need to disconnect that anymore. And so it is like incremental, and I think a lot of things in life are incremental, and I think I have a video on this, but most people don't go out and win the lottery, and most people don't go out and lose 100 pounds in a week. It is incremental. And when you want to get into surgery or want to get into medicine and you're not sure if that's for you because you're queasy about stuff, that doesn't mean you can't do it. I would say to you that think about incrementally improving your tolerance for grody stuff. Grody is a scientific word I learned from my 4-year-old niece. Okay, you guys, that's a quick one, but hey, thanks for watching these videos. And of course, if you want to go into medicine and you're having a tough time in school, I do have a study course where I help you figure out your studying and be able to study like top med students, so you can get into either college or med school that you want. So check that out. I'll put that in the link below. It's called secretstudyhacks.com, and it's just a good community of people as well. We have a Facebook community, and everybody helps each other, and it's really awesome. So if not, no biggie, and keep watching these videos. I will see you in the next one. Share, subscribe, like, all that good stuff. I'll see you in the next one.